then after that we can take your evidence. So I'm going to ask you to stand up and raise your right hand. Are you a Christian or you follow any other religion? Christian. Okay, so you will repeat after me. Yeah. So the full name, you said Antoine. The full name? Brian. Okay. So I, Brian Antoine, I swear by Almighty God.
I swear by Almighty God.
That the evidence I shall give.
That the evidence I shall give.
To this commission.
To this commission.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but truth.
So help me God.
So help me God.
Okay, thank you, Dr. Antoine. So just to remind you of a few rules that we would like you to observe. You know, you have to observe all the other rules, but this is important for us to remind you. The first is for you to tell the truth, nothing but the whole truth, as per your oath. It is a criminal offense to deliberately mislead the commission, either by giving false evidence or by withholding information that you know. Then secondly, just answer the questions that are asked by the commissioners and answer them as they are asked, to the best of your knowledge. Number three, please conduct yourself with dignity and respect, including when you are referring to other individuals in your testimony. Then a reminder for everyone in the room to refrain from interrupting proceedings. Please make sure that your mobile phones are on complete silence, or they are switched off completely, so that we don't interrupt the witnesses as they give their testimony. Please also minimize movements around and in and out of the room. Okay, so Dr. Antoine, what we're going to do is we will take turns to ask you questions.
Okay.
I will ask you some few questions, and my colleagues will jump in along the way. Is that fine?
No problem.
Okay, so you are a medical doctor.
Yes, I'm an orthopedic surgeon.
How long have you been practicing as a doctor?
16 years as a doctor and going on 7 years as an orthopedic surgeon.
That's important. What does an orthopedic surgeon do on a daily basis? What do they specialize in?
Normally, we attend to the part of orthopedics and traumatology. Orthopedics are everything that have to do with bones and the system, musculoskeletal system. And trauma is all the damage, the harm that is done to the body that relate to this system. Either fractures, pain, laceration, dislocation, everything that fall into the traumatic orthopedic.
That's interesting. So, is it true that you participated in treating one or two of the prisoners who were injured as a result of the events of 5 and 6 December 2024?
I was on duty on this day. Actually, I treated mostly all the ones that have orthopedic trauma that came to casualty to our unit. And most of them I treated on that day. And I had some other colleagues with me also.
Most of them?
Yeah.
Roughly how many?
It's difficult.
Just an estimate.
Maybe more than 15.
More than 15. When you say orthopedic trauma, just for lay people or someone who is not well versed with medical language, what does that mean?
part of traumatic injuries like laceration, like fractures, like sprain, dislocation, all these things englobe the part of traumatic orthopedic.
So you treated more than 15 patients on that day.
Roughly. I don't have the exact data,
Right,
but
perhaps
more or less.
in order for us to get a picture of the degree and the nature of the injuries that were sustained, maybe let's focus on specific patients that you really worked with or worked on. Would I be correct that you treated Mr. Shabani Kizamba?
Shabani, actually, I did not treat directly, but one of my colleagues did, and the patient was discharged on that day, but he came back with infection, like I think 4 days after that. We had to admit him and do the necessary management for us to attend to his infection of the wound. And he spent quite some days on the ward because he needed to do some serial debridement of the wound.
Okay. But are you in a position to speak about, or did you see and examine at any point his injuries?
When patient was on the ward, yes. But directly on this day in casualty, it was one of my other colleagues that treated the patient, actually.
Did you directly treat any other patient?
Yeah, a lot of them.
I just want us to pick one who you can speak authoritatively about their wounds and so forth.
One of them that was a bit, the injury was a bit critical was Fabio itself.
Okay.
And he needed urgent attention, and we had to bring him to operating theater the same day.
And you treated Fabio?
I treated him personally.
Okay.
Yes, on this day.
So maybe let's talk about him. What were the major injuries that you observed on him?
For Mr. Fabio, when he came on a stretcher. When I saw him, he was lying down on a stretcher. He presented 2 major wounds. One on the anterior aspect of the lower leg, of the left lower leg. It was a wound around more than 10 centimeter, 10 centimeter by 5 centimeter roughly, with exposed muscle, skin, and also exposed bone. And also he presented another wound at the posterior aspect, mostly at the same level. It was a bit smaller, around 6 centimeter by 4 centimeter like that. Also with exposed devitalized tissue that needed urgent attention to operating theater to debride the wound and try to externally stabilize the fracture. It was, yeah.
So, when you look at these wounds or these injuries, and when you examined them, did you manage to find out what could have caused them?
Not speculating as such, but normally those type of wounds we associated with high energy trauma. We don't know what is the specific nature of the instrument used to cause such wound, but normally we classified this wound as high energy trauma.
So when you say high energy trauma, you are talking about shock that the body experiences.
Yes.
Is that okay? And usually as a result of
an external forces that apply to the body and create all those damage.
Yeah. So you cannot tell us exactly, or You don't have any idea as to what could have caused, what instrument would have been used to cause such injuries on Mr. Subramanian?
Specifically, directly, I cannot say per se that it is, because I'm not a ballistic expert, but when you checking like the X-ray, the CT scan, the amount of metallic foreign bodies, and it's difficult for me to speculate which type of, but there were presence of foreign bodies and metallic.
Because you mentioned ballistic, that would be something implying that it is from an arm, like a gun.
It must be an object, but yeah. I can't determine telling you that this was like a firearm or anything, but it can be anything. It can be a firearm, it can be, I don't know, because I'm not an expert.
But like the tearing of tissues and everything, because something would have penetrated within, so as to hit the bones. So you have no idea, as an orthopedic doctor, as to what could have caused that.
Personally, I've seen those type of trauma. I can say that most of the time it's from like a firearm, but I cannot say for sure because like I say, I'm not a ballistic expert to tell you that this is perhaps from a firearm or, you know.
Yeah, but perhaps at this point, we want to just establish whether when you say metal objects inside the body, we just want to establish whether it's reasonably possible that they could have been as a result of the firing of bullets. We're not saying that's your evidence.
It's totally possible.
Okay. We are saying that because we are testing that because we have received testimonies and other forms of evidence, which shows that ammunition, like guns and bullets, were carried into the prison and were used during the operation. So that's why we are asking you that question. So when you are saying metallic, how are you able to indicate how many metallic objects were inside the body?
It's multiple metallic objects, like the CT scan informed that it's from 4 to 5 millimeters, like the biggest one, but there was a lot. And it's still, I think, he's still possessing his leg some of these metallic fragments.
So when you say it's multiple metallic objects that are inside
something
the body,
that have spread, because it's deep in the tissue.
Which part of the body were they?
Sorry?
Which part of the body, these metallic objects?
Yeah, it's in the leg, the same leg that he got the injury, the left leg. Okay. And also it have gone deep in the posterior aspect of the muscle of the leg. Because you can clearly see on the X-rays and the CT scan that the evidence is there of the metallic fragments.
Dr. Antoine?
Yes.
I've got just one question. Yeah, you say that you can't really say what sort of instrument was used. You say it could be a firearm, or it could be something else. What something else do you think existing in the world that could have caused such injury to leave all of those foreign metal bits inside the person's body? If you know of any.
This is difficult because I'm trying to wrap my mind around it. It's difficult to say because normally most of the firearms that create such like a blast for you to be able to get fragmented piece of metals, and it's very difficult. Maybe sometimes unexplosive things like that. This I cannot shape up for sure. Like grenades or improvised type of grenades, you know.
Yeah.
But I cannot say for sure it's a firearm or grenades, but it must be something that have sufficient power to be able to penetrate the bones and the soft tissue, and I think so.
But when you see the wound,
Yeah.
it is something that was it was not a large sort of explosion. It was a very directed hit.
It looked like according to the pattern of the wound, it might be a concentrated area where, because if it was like a distance, it will all over the place. But it's
So that's why
localized mostly at the leg itself.
Okay, that's where I was coming from. A grenade,
Right.
its way of explosion is a sort of scattering sort of
Injury.
of explosion. Yeah, and and what the fragments would do, it would not be concentrated directly to this specific part of the body. It would have hit other parts of the body if it was a grenade.
Yeah.
Okay.
So, what could be some of the potential consequences of this kind of injuries? But I'm at this particular point talking about the metal objects that are the metallic objects that are inside the body, which we are suspecting could be bullets. I mean, in light of the evidence that we have received, what could be some of the potential consequences of those objects?
Normally, as a foreign body, which is not supposed to be where it is at the moment, first thing that it can create some immediate complication, some damage of the arteries, of the nerves, and the muscle itself, and also later on infection. And I think these are the main,
These are some of
the main complication it can produce.
Did you remove these metallic objects?
As his injury was severe, I had to bring him to OT, to operating theater, because those wounds need a thorough debridement. You will never be able to remove all of this. Most of what I removed came together with the soft tissue, with the muscle that is dead. And individually, it was difficult to remove because all of it was embedded inside the soft tissue itself. And it's very difficult for you to remove one or twice. Meaning for me to say that I remove and keep it, it was impossible because at that time, in my mind was saving the leg of the patient, do a good debridement, and most of it came together with the soft tissue that I was removed. But as I said, you'll never be able to remove all of them because if you remove all of them, meaning you have to remove all the leg. And it's very intense surgery.
I know that you said with Mr. Shabani Kizamba, you didn't treat him on the day that he was.
Yeah, but when he came on the ward to be admitted due to a deep infection.
Yeah. So, but when you were treating the deep infection, you obviously noticed the wound, the nature of the wound.
Yeah, but on the ward, when the patient was on the ward, because me personally, I never brought him to theater to do the debridement.
Okay.
But we treated him as a team on the ward.
What kind of wounds did he have?
He possesses a wound at the posterior aspect of the cuff, you know, meaning at the back of the leg, the two gastrocnemius muscle and the soleus muscle was there. Okay. And we had to debride to remove the part of the septic, the one that have already died, the devitalized tissue. And then we also sent him for hyperbaric to stimulate the regeneration of the wound itself.
Okay.
You said that the wound was more to the posterior of the leg?
Yeah, at the, you know where you have the two big cuff there, the cuff? We call it cuff.
Yeah.
Yeah,
So
it's,
I'm just wondering, from which angle would, if any firearms was used, from which angle would that have been
The
used?
only way you can reach there is from the back
From the back,
or from the side.
yeah. And in the case of Fabio, from which angle? do you
This will
think?
be difficult to determine because you have two wounds.
Yeah, he had two wounds.
Yeah,
Both from both sides?
different sides. There is one there, but it's connected. It's connected. The one anterior and the posterior, it's connected, but both of them are not the same size. This is
And
difficult
you can,
because the forensic scientist will tell you which angle it is from the front or from the back.
but you don't have that knowledge.
I don't have this knowledge to determine which side it was the one started
You want
to
to
occur.
please? But,
Yeah.
but if you want to show it, then we have to give you a discretion first.
No, it's okay.
Okay.
So I know you've seen. I've got the picture of the wound of Shabani in front of me. Again, the question comes: do you think it was a grenade, or, in your words, in your opinion as a doctor, do you think it was a grenade or it was a firearm which was directly fired to this part of the body?
Like I say, I'm not a fire expert, but grenade will do much damage. It will not only concentrate on the leg itself, it will be also different parts of the body at the back.
That would
Maybe
be the damage caused by a grenade.
Yeah.
Okay, because a grenade has got so many shrapnels flying all over the place, so it could have hit him anywhere on the body as well. So we are saying now this is not a grenade.
Yeah.
And is there a possibility that it was a gunshot wound directly fired at this?
It might be possible.
Okay.
So, Mr. Shabani Kizamba's medical report, and he has given us the consent to discuss it with you and in public. It actually says provisional diagnosis, one gunshot injury. What in when a medical report is presented in this way, what does that mean? What is provisional diagnosis?
Provisional is not a definite diagnosis, not a final diagnosis.
Okay.
The one that you give it before you complete your full diagnosis.
Okay.
Just temporary diagnosis.
Okay. And I just want you to help us and also the public to understand the language that is used here. And then then it also says he has an extensive wound at the posterior aspect of right calf. Which part of the body would that be?
It's just behind the leg itself. It's the part where we call it the gastrocnemius muscle, because in other language like Latin, we call it los gemelos, it's two muscles that are identical, and it have a third one that normally we call it the sural muscle. And the one where we call it light and curl, but we call it the Achilles tendon, because the prolongation, it constitutes the Achilles tendon. It forms the Achilles tendon,
So
like the two muscles up.
Okay, is it this part of the body is generally at the back of a human body?
Yeah.
So if we take what is on this report, which says one gunshot injury, if we take what is here, would that mean that the shot was fired at the back of the body? The
area where we say gunshot injury is alleged by by the
Yes.
inlets itself, you know.
Yes, yes.
But our diagnosis, we
I know you
classified
don't,
it.
you don't comment on that.
Because when you don't know what it is, you cannot put for certain that it is gunshot. Yeah.
Okay. But the wound that
wound
we are
itself.
discussing is at the back of the body.
At the back of the body.
Okay. So, and I'm okay. So at the back of the body, which, if it is true, I'm saying if it is true that it's a gunshot, then it means that the gun was shot when this human being was facing the other side.
Most probable.
I'm not saying you are confirming whether a gunshot was used. You wanted to ask question.
Ash was going to ask the same
The
question.
same person. Please go ahead.
Now, in the Shabanese case, doctor,
Yes, sir.
did you, on treating later, when you said he came to hospital,
Yeah.
did you notice any other foreign bodies as well in his wound? You know,
Me personally, not. Maybe some of the colleagues, I don't know if they found something, but me, I didn't. During treating phase, like I said, I never brought him to theater to do the debridement again after the infection. And I cannot say for certain that there was or not foreign bodies inside or not.
Then I'm still going on the Mr. Kizamba's medical report. Says on examination of the right calf, right, which is that part of the body we're talking about, the muscle is devitalized. What does that mean?
Devitalized meaning that it no longer have the vitality, like it don't bleed, muscle, it's frail. There's no blood circulation at these areas of the muscle itself. That it need to be removed. If not, it may lead to infection.
Okay. And in long term, how would such injury affect a person's mobility?
Normally, the muscle of the gastrocnemius muscle or the gemellosucal or the cerebral muscle, the main importance of the muscle is to provide we call it dorsiflexion, plantar flexion. Plantar meaning the area of the sole of your foot. When you flex it down, this is the function of the muscle because it pulls the Achilles tendon. The Achilles tendon is attached to your heel, so it pulls your heel up, so your foot can press down. This is maybe you get some weakness of this function.
So
but the most function of your foot is dorsiflexion for you to lift it up, for you to walk.
So I'll be right in saying that it would affect mobility and that he would not be able to walk
To some
properly?
extent, yeah, but not fully. But it may affect just the motion of plantar flexion of the foot itself.
Would such a patient need to have crutches? Would need to use crutches?
No need. I don't think so. Because the most function of the foot is for you to elevate, for you to be able to walk. Yeah, because the plantar flexion sometimes come with gravity, itself.
But what if the patient, the incident happened on the 5th and 6th of December 2024, and if in 2026 the patient is still unable to walk properly and has to use crutches, what would be the cause of that?
Cannot say for certain because I have not followed the patient since the incident and won't be able to say for sure.
No, but the patient actually, we met when the patient is still walking on crutches. So I'm just trying to understand as to what could have caused this prolonged use of crutches.
Maybe some stiffness of the area where the scar tissue is. Maybe this, but I cannot say for certain because I have not really examined the patient lately, for me to arrive to a definite diagnosis why is his complication is taking too long to recover.
Doctor,
Yes, sir.
When injuries take place in people, normally young people would tend to heal faster. and progress, more positive progress would happen to that person. Now, when age is catching up, for example, in the case of Mr. Shabani, age is catching up, and obviously with such an injury, would that give him other problems or aggravate his problems in mobility later?
I will say one thing. Every patient is different. Your recovery, even though you are at this age, might not be the same rate of recovery as someone else at your age. It depends on some factors, maybe the constitution of the patient, the level of activity that the patient do for it to remain healthy. And it's a lot of the amount of nutrition the patient takes. It's a lot of factors, I can't say for certain why his recovery is so long, or it might be a lot of factors that include in this patient that is lengthening the amount of time that he's taking to recover.
In simple language, the two patients we are talking about, Fabio and Mr. Fabio and Mr. Shabani, one would be correct to say the nature of their injuries are serious injuries, right?
Because one of them, we call it severe traumatic injury.
Severe. Okay, so the correct word is severe, which in common language means it's serious.
Serious on the orthopedic ward, it's like the amount of damage to the soft tissue itself, because the soft tissue is really viable to protect the bone itself.
Okay.
To protect the bones without soft tissue to cover the bone, because it's one of the major organs that provide the blood circulation to the bone itself to remain to keep the bone healthy. Because when the bone is exposed, it comes with a lot other complications.
Okay. Please go ahead. No, you didn't. No, he didn't say. Okay, you can ask him. You can ask him, but I don't think he saw you. Yeah.
Doctor, just a quick one. Yeah, if you did see or you did not see, when you were working at the ward, did you manage to see a patient by the name of Mr. Francis Ernesta?
This patient was one of the patients admitted on Dauphin ward, I think. Yeah, I think we saw this patient, I think.
You did see him?
Yeah.
Did you treat him?
Patient actually treat him directly, I don't think so.
Yes.
But he was one of the patients on the ward.
But amongst doctors, did you talk about his injuries and...
I believe he had a humerus fracture, the right side of the body.
Can you explain what humerus actually?
Humerus is the part of the bone before your shoulder. It is between your shoulder and your elbow. It's the only one bone that you have. It's like in your arm. I think he has a fracture there.
So that's the only thing you
on the orthopedic side, I think it was the only fracture it has for me. I don't know on the part of general surgeon or other specialties if he has other injuries.
Yeah, but I think in the interest of making sure that we have a complete picture, you did not personally treat this patient.
When he was in casualty, patient, we put the back slab. I remember putting the back slab on this patient because they call us, because it's a when you're in casualty, if a patient has more than one injury, I think all the specialties need to come together to attend the patient. And I believe we put the back slab on the patient.
Yeah. I'm saying this because we have received evidence which shows that his injuries were more severe, serious than what you are saying.
Okay.
And so I wouldn't want us to speculate about his injuries.
I can say for sure, because for me, on the part of orthopedic part, the only injuries that was attributed to the department was a humerus fracture. That normally those fractures are not, if it's not open fractures, they are not serious injuries, and you don't need to do any surgery unless if the patient have a paralysis.
I think let's end it there on Mr. Francis Enesta, because you didn't examine him. I think let's rely on the evidence that we already have, which I think speak authoritatively on the nature and the degree of wounds that he sustained. Is there any other question?
Yeah. As regards Mr. Subramanian, can you tell us for how long he was in hospital?
I believe he has been with us for a while. I think 1 year, I think.
So, and after 1 year, were you able to fully treat him?
Actually, we present him on the board for him to get overseas treatment, because some of his treatment we actually do not have the enough resource for us to deal with his injury, and that's why I think we, as a team, we decided to present him on overseas treatment board for him to get further management, orthopedic management.
So up to now, or at the time that he received, he was sent overseas for the treatment. Did he have any mobility in that leg that was affected?
For now, he do not have mobility, because he did the first phase of the treatment, which is to treat the soft part, the soft tissue that was damaged. I believe they did vascular flap muscle graft to cover the area where there was the wound itself, but the wound was not healing, and maybe later he will go for the bone surgery management for him. Because he did the first phase, it was successful, but he still needs to go for the bone itself, because it is in 2 phases. First surgery is a lengthy surgery, more than 8 hours, I believe, maybe 10 hours. And because normally it's a group of microvascular surgeons that they need to carefully remove a flap with the blood circulation itself, with the artery itself, to reimplant it with the artery that is in the leg for the flap itself to be viable, like, yeah, I believe. And now he need to go for the second phase of the surgery. And the leg is still not mobile.
Okay, and that second phase would be for the bones, which is still fragmented?
For the bones. Yeah, because normally they remove the part of the bone that was not viable over there where he went. They remove the part of the bone, and they put an intramedulla, it's like a nail inside, just to keep, because when you're doing the graft, you're putting the graft, you need the leg to be stable. As they remove the part of the bone that is not healthy, they had to put a nail inside just to keep the leg aligned, and also for stability, because the graft cannot move, because if it moves, it will fail. And now I think he's supposed to go back to do the bone surgery itself. I think it's bone lengthening to help the bone to start healing.
Okay. All right. Do you have any follow-up question? Okay. So, Dr. Antoine, we thank you for your time. We know that today is a busy day for you. But we thank you for your time to come here and help the Commission explain what is in the medical reports that are before us. The information you've given us will help us to understand the degree of and the nature of these wounds, and then connect the dots with the other evidence that we have received. I would like to remind you of your right not to be victimized by anyone for having given the evidence that you have given today. No one has any power to even question you about your testimony this morning or any part of it. If anyone wants to challenge what you have given us this morning, they can also contact the Commission, and the Commission will take their evidence. So thank you for that. Maybe before we end, just a few things to announce, and then we can conclude. So the first is because this is a public process, where there's a public interest in following what the Commission is doing. We have a calendar where we have divided our sessions for hearings into 3 or 4 components. So we have concluded the first session of our hearings. We are now preparing for the second session, which starts in 2 weeks' time. And this is purely on the basis of our calendar. Because after taking evidence from all the witnesses that we have spoken to, we need time to review the evidence. Well, we review the evidence every day, but we need a dedicated time to review the evidence, identify individuals who may have been implicated as potential witnesses in the testimonies that we have received, and then plan for the next phase of the hearings. I think it is important, it's public knowledge, it is important to acknowledge that there is a court action. We are not going to comment about that. There is a legal process which is dealing with that. But just to clarify that our recess has nothing to do with the court action. It is because we have planned it in that way, that we need to break the sessions, separate them 2 weeks, so that we can have time to review the evidence that we have. In the meantime, we continue to encourage members of the public to come forward with any information that they think can help us to uncover the truth about what happened on 5 and 6 December 2024. Continue to use the same channels. Our email address is on the website. In fact, the website details the different channels that you can use to contact the Commission. There are instances where there are 2 ways or 2 reasons why we may encourage members of the public to contact the Commission. One is if they have evidence that they think the Commission can use to find out the truth. Please write to the Commission and indicate that you have some evidence, and we will then arrange to take that evidence, or email the Commission and send the evidence. The Secretary may need maybe at this point to clarify the email address that we use. Would you just maybe make an announcement of that email address? I know that it's there on the website, but maybe for the convenience of those that are following this. Okay.
The email address for the commission is commissionofinquiry@gmail.com.
Maybe you might repeat that, and then the phone number as well.
The email address for the Commission of Inquiry is commissionintoinquiry@gmail.com, or you can contact us directly on 282-1572.
Thank you very much, Secretary. Thank you very much. So, like we indicated, this information is on the website, so you can check on the website. Otherwise, thank you very much, and the work continues.